Good afternoon. My name is Carlos Sanchez, and I'm Director of Public Affairs for Hidalgo County. Thank you for joining us this afternoon for a conversation with Dr. Ivan Melendez, the Hidalgo County Health Authority, who's going to give us some context about our current state of affairs as it relates to COVID-19. However, before that, County Judge Richard Cortez is joining us briefly, who wants to make a few words in terms of an announcement. Please, to you, Judge Cortez.
Thank you, Carlos. Well, good afternoon. This is County Judge Richard Cortez. As you've been hearing and if you've been paying attention, we've had some very high numbers of new infections and fatalities here in Hidalgo County, which are certainly very unacceptable. We can't allow this to continue. We have to take every precaution necessary to protect the health and well-being of our citizens. The report that we're getting is that a lot of the reason for these infections is really the activities of our people here in Hidalgo County, and also the lack of their willingness to take the necessary precautions. There are certain protocols that are out there already that we all know about them that work. When we had those restrictions in place, we enjoyed a very, very low rate of infections and a very, very low rate of people in hospitals or with serious illnesses in the ICUs. Today, that's not the case. One of the goals that we originally had was not to overwhelm our healthcare providers, our hospital beds, and that sort of thing. Well, today we're very close approaching to being at capacity. For that reason, we're in the process of putting a new order in place. That order in place is going to require certain things. I'm going to impose a curfew for people that are 17 and under from basically staying in their household between the periods of 10 o'clock and 6 o'clock in the morning, and for people over 18 from 11 o'clock at night, to 5 o'clock in the morning. This is very important to us because one of the reasons for this increase in infections is that we're just having a lot of people continue to gather. They gather at night, they gather at parties, they gather at other functions, and this has been the primary cause of all this infection spreading. And a lot of it has been attributable to young people. So with this curfew, and we're also going to prohibit any social gatherings outside the household of no more than 10 people. And there'll be other restrictions and other encouragement and comments that we're going to have in this order that is yet to be finalized, but it will soon be coming. But I ask you, I beg you, that the power to stop this virus, the power is within us. We have to continue to follow all the protocols and all the precautions if we're going to put an end to this. We cannot afford to go into hurricane season and flu season on top of this virus. So this is action that we must take, and I hope that we will be receiving all the cooperation of all our citizens. And for that, I thank you. I thank you for that.
Thank you very much, Judge Cortez. I know that you're busy. You've got a number of meetings to attend. So we're going to leave you at this point and be joined by Dr. Ivan Melendez, who is the Hidalgo County Health Authority. Dr. Melendez, are you there?
I am. Are you capturing me?
Yes, you're there and available. Is there any parting words you'd like to say, Judge Cortez?
No, thank you. Listen to Dr. Melendez. He's an expert and he's been one of my advisors and has helped me tremendously through this process. So please listen to him.
Thank you again, Judge Cortez. Dr. Melendez, let's start from the macro. And if you could just describe a little bit what your job entails as Hidalgo County Health Authority.
Absolutely. Let me start off by thanking Judge Cortez for working very close with us at the health department and always being receptive to the medical community and what their take is with our local experts and our local experience that we're having. My name is Ivan Melendez, here from the Valley, living here since '65, and I've been the health authority for the Hidalgo County now for over 10 years. Health authority is the physician that has been appointed to as being the liaison or the voice of those issues that deal with health and well-being between the county and the community. My responsibilities entail keeping the public informed of what the health issues are and what the recommendations are from the health department. In addition, I supervise the delivery of health care for our county clinics, which provide prenatal care, well women's care, OB and deliveries, vaccinations, and tuberculosis. I represent a team of many professionals in public health, epidemiology, nursing, etc. So my job is to keep the public informed of what is going on from the health perspective and give recommendations of what we can do to increase the wellness of our community.
Dr. Melendez, back in early March, before we had a single diagnosed case in Hidalgo County, you said it was appropriate for the public to be concerned, but not to panic. Where do we stand today?
Well, it's always a gradient, and panic is always a place where we don't want to be. So certainly panic doesn't resolve or help. Panic to me means you give up and you don't think clearly of what needs to happen. Concern, which is probably a better term than worried, means that you're taking the information available and you're deciding whether you need to have a higher level of attention to it, develop plans, etc. I believe that currently it is appropriate to be concerned where we are now. Obviously, when we did not have any cases before March 21st, and to the point that we are now, our level of concern is increasing. We have been able to identify the trends that are coming forth, and we have been attempting to be nimble and to move and to establish different priorities depending on the data and the information at hand. Today, the 24th of June, as a public health officer in the County of Hidalgo, I am notably concerned about our current status with the coronavirus.
And indeed, that status is one that has been marked over the past week with several record-setting days. And today we are on pace to potentially break another record in terms of the number of new cases. Does that heighten your concern at all?
Well, absolutely. So what we're seeing the numbers that we consider to be giving us a pulse of what the current status is of this pandemic have all trending in the wrong direction. Our hospitalization rates, and let me tell you before I tell you this, I'm also an active clinician. I go to all the hospitals in Hidalgo County with the exception of NAP. I take care of the COVID patients myself. They're on my service. So not only am I involved in the macro perspective, helping our elected officials with policy recommendations, but also I'm where the rubber hits the road. I'm in the COVID units. I'm talking to these patients. I'm talking to the families. And so I believe I have a very pragmatic perspective of what's going on in our at least hospital population. In addition to that, I'm on a daily communication with our community physicians that are also giving me information of what they're seeing in their clinics and what their concerns are. With that in mind, the numbers that I was alluding to that we're following that's causing a greater concern on all of us in the medical community refer specifically to number of hospitalizations. We've seen almost a fivefold of hospitalizations within the last 2-week periods. It was not uncommon for us to hover around 19 or 20, 18. And in fact, before May 1st, when we started opening up the economy, we were down in single digits in hospitalizations. In the last 2 weeks, our numbers are now approaching 200. Yesterday, we had over 150 people in the hospital, hospitalized. Keep in mind that only 10 to 20% of people that get this infection require hospitalizations. So those people that come to the hospital are people that have coronavirus that are moderate to serious. There are many people that come to the emergency departments, they're diagnosed and they're discharged home with the appropriate quarantine precautions. But those numbers that are being admitted are exponentially growing 5 times, 6 times in the last several weeks. We're now approaching the number of 200. All our major hospitals, to include NAP, Mission Hospital, Regional Hospital, Edinburgh Hospital, McAllen Medical Center, these are major hospitals in Hidalgo County, have all either extended their beds that they have now or about to. So every single hospital has increased their bed availability by using other parts of the hospital that was part of their contingency plan, but were not being used before. So for example, I just left Doctors Hospital. They're almost up to 60 folks. Their unit can only take 58. So they're making arrangements to open up other parts of the hospital to accommodate that. Regional Hospital has opened up 2 units and now opening another floor. Edinburgh Hospital is doing the exact same thing. Mission Hospital has opened up units near the emergency department because their census for COVID patients is extremely high. Knapp Hospital, unfortunately, I don't have that information for you at the time that we're doing this, but I can tell you that all of the hospitals that I'm aware of are exceeding their bed space, their original bed spaces. They still have spaces, of course. They're not saturated yet, but they've had to carry on their previous set contingency plans. They have not panicked. They have pre-planned of what they would do in case this occurred. And now those plans that were laid out months ago are now being put into action. That is to say that there are further plans should this hospitalization growth continue. In addition to that particular number, which I've only mentioned one, the number of hospitalizations, we also look at a number that is the percentage of those patients that are tested that turn positive. Frequently, we hear a lot of people say, well, the reason that we're having more people turning positive is because we're testing more. And in fact, on a national level, that's been one of the opinions that is being set forth in the media, that the reason that we're having more numbers is because we're testing more. So what we looked at in epidemiological perspective is we look at the percentage of people that are being tested that are positive. These numbers are also concerning. When we initially started looking at these numbers back on March 21st, the first parts of March and the latter part of March and the first parts of April, our average was very high. It was around 17%. The reason being is because we were only testing symptomatic patients that were associated to the original folks that were getting these diseases. So we had a household member, we would test 5 or 6 of them, and a lot of them would become positive. So our percentage positive rates were extremely high. Once the numbers started to increase and we started testing other people in the community besides contacts of those infected, our numbers began to come down. So our numbers went from 15% originally down to around 2%. We're at a point where we're at 1.8% before the reopening on May 1st of our total percents. Currently, UTRGV is testing about 2,000 people. The military is testing about 2,000 people. We at the health department are testing about 200 people. And the private physician's office are also testing in the hundreds. So we're estimating anywhere between 4,500 to 5,000 people are being tested a week. Remember, it took us almost 2 months to get to 1,000 people tested because we didn't have the capacity to do so. So now that we're testing 5,000 a week, of course, the numbers are going to be dramatically high. Today's numbers, which will be publicly made available at another day, later on today, are the highest we've ever had, and they're above 300. And my point is that percent of numbers of people that turn positive, which is a true indicator, is increasing. Currently, our number is at 6%. 6% of the people that are tested currently in the Hidalgo County are turning positive. How does that compare to the state? The state is at 9%, getting closer to 10. So there are several hot spots in the air in the state that are also increasing the percent positive. The nation, it's a number that it really doesn't tell you much, because there are some parts in the nation that are 0%, and there are some parts that are 30%. So I think it's better to look at the state number and the local number. So we're at 6%, trending upwards. Last week we're in the 3s, now we're in the 6s. So even if you test more people, you're getting more percentage positive. That tells you that we're definitely getting more people that are getting infected. It's becoming a serious problem. The third thing we looked at, remember, the first was the total cases. The second, which is exponentially high. The second is the percent that are positive that are tested. The third number that we look at are the people that require intensive care units and ventilators. That's the fourth thing we look at. All are also dramatically increasing. There was a time when we were down to 2, 3, 4, 8. A couple of weeks ago, 14, 15. Today, we're going to have probably in the 30s of people that are new ICU patients. So our ICU patient numbers are up, our ventilator numbers are up, our people being admitted to the hospital are dramatically up, the people that are testing positive are dramatically up, and the percentage of those that are tested turning positive are up. So all of those 5 denominators that we look at are trending in the wrong direction and quite worrisome.
Well, to be sure, World Health Organization has suggested that a positive rate of 10% or below is adequate. And what I'm wondering is, at 6%, is that a case for worry, or is it something that is in lockstep with the other factors? I mean, we always knew as tests were going to become more available that the numbers would rise. So what is kind of the nature or the crux of the concerns today?
That's a very good question, Carlos. And I think people that might be listening, because there's so much information from so many different sources, sometimes the information overload can be a little bit difficult to decipher. And so from my perspective, and from our audience's perspective, I would like to focus really on the local numbers. The World Health Organization, of course, is looking at the most macro, at the most global level. From our perspective, I think what's important is to look at locally in our numbers. The reason I say that is because, yes, people say that at 10%, that most places are able to have the resources to take care of those folks. That being said, ask the people in Mexico, ask the people in Peru versus asking the people in Paris, or asking the people in Rome, or asking the people in Houston. All these health systems have a different number of percentage of positives that their health system can absorb and do well with. What worries me at 6% is the rapidity, the quickness of which those numbers have increased. Now, the other issue, and I may be biased to a certain event because I do all of my clinical work in the hospitals. And so I'm seeing the, I guess if you will, control chaos. I'm seeing the impact that this accelerated rate is causing in the hospitals. I'm seeing the staffing issues. I'm seeing, let me give you an example. There's one hospital today. They have, of their 50 plus COVID patients in-house, 23 of them require hemodialysis. So those hemodialysis on people with COVID, they have to be done at bedside. Well, of course, we also have a lot of people in our part of the country that go to the emergency departments to get emergency dialysis because that's their only source. They're not able to have a routine dialysis at dialysis centers. So imagine if you're having 23 bedside dialysis and then you still have to take care another 40 or 50 people a week that need to be dialyzed in the emergency department. So that's an example that I would like the public to know how even a doubling in our percent rate begins to tax significantly the resources that are available. Right now, do I believe the resources at the hospitals are being taxed to the point of saturation? I do not. Now, if we were doubling, if we were at 6% today and we're at 12% in 2 weeks, and we're at 24% in another 2 weeks, that would be a catastrophic event for us. Of course, there are plans should that occur, and we can discuss that at your will. But the answer to your question, because I know I tend to drag on, is 6% significant to the World Health Organization at 10%? My succinct response is absolutely, when you see the quickness that it has doubled.
Dr. Melendez, early on in this crisis, there was a term that became commonplace, flattening the curve. And we haven't heard much about that lately. And I'm just wondering where we are with regard to that curve, because it seemed like Hidalgo County was doing fairly well.
Yes, I wish that I had the capacity right now to show you the graphic, but these graphics are available on the Hidalgo County Health Department website. And they're distributed to most of the local physicians. They have those available too, should you want to see these graphs. But flattening of the curve, originally, the reference was if you created a graph which had the number of patients, new patients that were being identified versus time, you wanted to make sure that the graph was an elliptical graph where you had the area underneath the top of the curve that would flatten out. So instead of having a U shape, you might want to have a T shape, or you might have a plateau a lot quicker. The idea is that those people that were in that, underneath that curve, no matter, depending on how high the curve was representative of those resources that were going to be required by the local health services, hospitals, doctors' offices, to provide care for folks. That we didn't have people like they had in New York City and other places where you would see the body bags that were just laying in rooms. There were so many of them. People that were literally in Italy, and you had to choose who was the sickest, because the sickest meant the least amount of survivability. So those people were not given the attention to those people those people that were thought to be salvageable. So the flattening of the curve was a very, very important perspective, because it gave us an idea of not only how many people over time, but what resources were available. So that being said, our curve was dramatically flattened until May 1st. And then 2 weeks after May 1st, where we opened up the community again, we started once again the curve increasing. Right now, if you look at the curve, it is the steepest slope, or the steepest increase that we have seen since we started. So before, the curve might have started up and then began to increase dramatically and then slow down and started coming down. Now it's straight up. And so we are nowhere near flattening of the curve. Some people would call it a second wave. And so the second wave was a term that was used in the pandemic in the early 1900s. Some people are not fond of that term, but what it meant is that we had another peak in numbers and peak in utilization, and we're absolutely on a second wave, or a flashback, if you will. So flattening of the curve was a concept that was used to determine number of people and where there were enough resources available. And people would also use it to determine how many people, new people over time. So our curve is not flattened. I think on a national level, people are tending to move away from the term flattening of the curve, because people would have different interpretations. But if the question is, are we having more people that require resources that is not flattening the curve? The answer is absolutely, we're not flattening the curve. Are we having an exponential growth or a large growth? I have to be careful with the word exponential, because exponential refers to a mathematical exponent that causes growth. So if you look for a pure mathematical definition, we do not have an exponential growth, because that means that every day you would double or triple. But we are having a notable growth. Yes, more resources are being needed. Yes, more people over time. And yes, a straight up look on the curve itself. So we're not flattening the curve.
Given all these indices that are pointing in the wrong direction, as you indicated, what is your major concern?
So my major concern, I think, is very intuitive to understand. our deaths have doubled in 3 weeks. We have people that are 40 years old, 50 years old, 60 years old that are dying. It's our average age of a person turning positive is no longer in the 60s and 70s when we were testing people in nursing homes. Now it's in the 30s. So the average age is 35 years old because so much at will, or that is testing without symptoms, is being done. So we're seeing that those mobile people, those people that are going to work, that are going to restaurants, that are going to dances, that are going to pachangas in our culture, those asymptomatic 80 to 90% or minimal symptomatic patients are running around the community because they don't have any symptoms. So my concern is twofold. One is that if we do not find a way to curb the amount of people that are turning positive, that we will overwhelm our resources that are available locally to help people. We've already received phone calls from other communities that are requesting perhaps transferring patients to our community because they're overwhelmed in their hospital systems. We have obviously advised not to do that at this point because we're at a crisis point too. But what that tells you is that there are other communities who are not as fortunate as we are to have so many hospital beds available that are already looking to send somewhere else. My first concern would be that we overwhelm our capacity to provide care for the acutely ill. My second concern is that I believe, and this is purely a subjective perspective, I don't have any science to back it up, but I believe that on May 1st, when we opened up to business, which of course we needed to. I mean, people are going under incredible financial duress. I don't think there's a person that would, maybe a person, but I think the vast majority of people would say it was time to get things going. But my concern is that the public, our audience, many people in the community believed, great, the problem is gone. They've opened up for us to be moving. And so with the opening of the community, then that means we don't have a problem anymore. I believe that the numbers are so dramatic right now that during the last perhaps several days, I've seen more introspection, more insight of people in the community beginning to understand that this is far from over. So my fear, my concern is that the people will not take serious the current situation, how dramatically it's changed during the last several weeks, and continue to not take the appropriate mitigation steps. I don't have to remind you, our audience, that this disease is not curable, that the only way that we can bring these numbers down and protect our community is by not getting the disease. And because this disease requires a human host, the only way that you cannot get it is to minimize your contact with other humans. It's pretty straightforward. If we look at the data, if we look at the curves, if we look at all our numbers, guess what? We were doing fantastic. I mean, we were doing textbook. Thank God, we were doing great. And then the moment we began to loosen up social interaction, our numbers exploded. So if you do something and it works, fantastic. If you change your treatment plan and it doesn't work, then you have to readjust. Remember, we're locally somewhat limited in the restrictions we can place forward that we had before, because now we're more mandated at a state level as opposed to a local level. But so my first concern, of course, are the numbers are increasingly great, overrunning our hospital system, and people not understanding how serious this is, thinking that because they're young and invincible, nothing's going to happen. And of course, more deaths and more serious disease in our community.
Today's conversation began with Judge Cortez announcing another course correction and the reimposition of some restrictions. Do you believe that's the right course of action?
Yeah, can you hear me? Because I've lost you a little bit. Are you still able to hear me? Okay, if you can't hear me, let me know. Absolutely. I mean, I believe being in meetings and interacting with our elective officials, that they have had, by far, their first priority has been to protect the community. I have seen them have the courage to take decisions that are vastly unpopular and that have dramatic financial impact on their constituents. I've seen them also attempt to understand that financial impact and try to do the best balance they possibly can. I believe that our local recommendations would be significantly more restrictive if they were not, I guess, mandated by the state level. I think that the state restrictions, in my personal opinion, based on Hidalgo County, have been much looser than what I would have recommended. And I believe that our elected officials, I can't speak for them, would have been responsive to those recommendations based purely on what we're seeing. It's hard to argue. So I think the question is, what is the right balance? And that I don't have the answer to.
Doctor, another public misperception that has long accompanied this disease is the notion that it's no worse than the flu. You as a clinician have seen on a daily basis the worst of the worst. Can you give us a sense of how bad this really can be when it attacks you?
So I hear that pretty often. I hear it in the press, national, state, and local media. I hear it from patients. I've heard even from some doctors that are not directly involved in the treatment of COVID patients. And what I hear erroneously is it's more people die from the flu, more people get hospitalized because of the flu. First of all, that's statistically wrong. As you probably know, the number one cause of death after heart and trauma about 2 weeks ago became COVID-19 in the United States. So COVID-19 has been the leading number one disease that leads to death in the last several weeks. We knew it was coming. So the difference between the COVID and the influenza is dramatic. The influenza virus has shown a dramatic capacity to change, to alter the way that it attacks people. If you know, when you get the flu shot, you're getting a different set of types of flus based on what was the most common flus types that occurred the year before. So every year when we recommend the flu shot, it's because it's a new antigen. It's a new way to get the body to make antibodies based on what was the most frequent the year before. And so it has been much more able, the flu has been, to change and attack. That's a very good thing for that particular virus because it provides its ability to survive. It's a very bad thing for humans. Fortunately, Corona, to this point, remember, it's a relatively new virus. November of last year, maybe October of last, who knows, but a relatively new virus. It has showed some mutations, but not anywhere near what the flu has shown. So absolutely, from that perspective, the flu is just as bad, if not worse. However, that's kind of a nerdy academic perspective. The reality of it is, or pragmatic of it is that the capacity for the coronavirus to infect a person is dramatically higher than regular flu. If you look, I won't bore the audience with the infectability descriptions or denominations or how you get to those, but we measure how infective one thing is versus the other. If you're in a room with a person that has, for example, polio or tuberculosis or the flu versus coronavirus, coronavirus is extremely infectious, extremely. So it's a much more dangerous type of phenomenon. Because, this is my personal belief, because it's so infectious, there's so many people that are infected. And therefore, whatever that percent is, say 10%, they get dramatically ill. I don't know if anybody knows that if every single day in the Rio Grande Valley, we were getting 300 new cases of influenza A, if we'd be seeing the dramatic end product of that influenza A, respiratory failure, uncontrollable pneumonias, because we're not getting 300 and plus more cases every day. But because we're having such large numbers, or in view that we have large numbers, we're seeing a lot of end products. We're seeing those 10% that are getting sicker. So to be succinct, different viruses, different ability to infect, and much more lethal the coronavirus has been. Same populations, those people that have comorbidities, the most common obesity and diabetes, which, as you know, our county is number 1 and 2 around the country in obesity and diabetes every year. And so our ability to minimize the infectability of the coronavirus is much more difficult than the flu. And we're seeing much more people dying from this particular virus as opposed to the flu.
Doctor, is there any understanding with regard to how our proximity to Mexico is affecting the direction of this infection?
That's a very good question. So I have a friend who works in Reynosa. He's a physician. And I've asked him to send me some rosters. The hospitals are booked solid with what they call atypical pneumonia. Atypical pneumonia. They reported a 15% rate of infectability. I don't know, of positives. I don't even know what that means because we don't know how many people they're testing, who they're testing. But I can tell you that there is a big problem south of the border with this particular disease. I do believe that there has been a very effective minimization or diminishing people coming over from Mexico over here and us going over to Mexico. You can tell by what our retailers are telling us, while our folks downtown are telling us. So we know that there's a lot less people coming over. The direct impact of those people that have infected our population or have brought it over from Mexico is unknowns to me. I can tell you that what I see based on what our epidemiologists are doing is that most of our infections that we're getting here are coming from other family members. Most of the people that we see, for example, now we're seeing because the military and UTRGV are testing people at will. We'll see father come in his car with his 4 kids and his wife. So we have 6 people in the car, father's positive, and so are the other kids. So we're seeing a lot of positive families. It's been hard for us to say, nobody in the family, this is the only one. He must have gotten it at Lowe's, or he must have gotten it at the restaurant, or he must have gotten it at work. Very hard to say that. On the other hand, we've had some other facilities, for example, assisted living facilities, where they have been very, very, very restricted on visitations and on movement. And all of a sudden they're getting 3 or 4 people that are turning positive. And you ask yourself, well, if no one's coming and no one is going, how are these residents that never leave the facility getting infected? And lo and behold, we'll find a healthcare worker there that turns positive. So is it that the patient gave it to the worker or the worker gave it to the patient? I personally believe because the patient goes home, and the worker goes home and the patient does not, it's probably coming from the worker, not from the patient that never leaves. So with that exception, I believe that the great majority of the transmission that we're seeing is in the community, and it's from a family member to family member. You know, we have a spike after Father's Day. We all have pachangas. You know, that our culture is we get together. You know, when you drive down the street on a Saturday or Sunday, you'll go by a house every couple of blocks where there's 10 or 12 cars that are parked on the street. So you know they're having a get-together there. I believe that this is one of the primary reasons why we're seeing this being, spreading the way it is.
Doctor, at this point, I'd like to bring in my colleague, Carolina Terán, who will be asking just a question or two in Spanish so that we can convey this message to the Spanish-speaking audience.
Yes, sir.
Carolina, please join us.
Muchísimas gracias. ¿Cómo está, doctor Melendez? Gracias por estar con nosotros aquí en el Condado de Hidalgo. Solamente nos estábamos demorando un poquito para darle la oportunidad de que haga switch y que ahora tengamos la oportunidad de hablar en español, un poco para nuestra gente. Gracias por estar aquí en nuestro Condado de Hidalgo, por supuesto, ser parte de este Departamento de Salud y, por supuesto, ser la máxima autoridad aquí en nuestro Condado de Hidalgo en cuanto a la parte de salud se refiere. Muchas personas quieren escuchar a un médico en vez de escuchar a otra persona. Tenemos la oportunidad ahora de tenerlo a usted, que es estudiado, que es graduado en medicina, que es doctor, señoras y señores, y todos los que están en este momento conectándose. Hablemos un poquito acerca de cómo vamos, doctor, en cuanto al COVID-19.
Bueno, muchas gracias, Carolina, y bienvenidos al público españolparlante, y gracias por recibirme. Es un placer, aparte de una obligación como parte del departamento de compartir información con ustedes. He tenido realmente el privilegio, la bendición de poder no solamente participar en una parte administrativa, pero también de atender en el hospital los pacientes enfermos con este virus. Entonces, tengo percepción de una dirección directa del estado de estos pacientes, el cuidado de estos pacientes, el dolor que están sufriendo los familiares, los impactos que hemos visto en la separación de las personas enfermas, de sus familiares que no pueden ir a los centros de envejecientes o no pueden ir al hospital a verte. He visto la tristeza de ver varios pacientes morir en soledad, sin sus familiares alrededor de ellos, que es una de las experiencias más realmente tristes que he tenido, ver a una persona de edad avanzada morir sola en un cuarto, porque realmente pues es difícil predeterminar que la persona se va a morir en 20 minutos o 15 minutos. Entonces, como las familias pueden solamente pasar a ver al paciente en los momentos finales y solamente una persona a la vez, ha sido muy difícil eso. Ha sido muy difícil personalmente tener pacientes de mucho tiempo que fallecen y nadie puede ir al funeral. Tiene que ser de lejos. Entonces, quiero que el público sepa que aparte de la cuestión administrativa, que es un placer participar, que también tengo esa experiencia de realmente estar viendo a los pacientes. La razón por la cual explico eso no es para realmente hablar del doctor Melendez, porque nuestro trabajo es un trabajo de humildad, pero para que ellos entiendan que es bien difícil, es bien diferente escuchar las opiniones y la información de una persona que lo está viviendo, una persona que está participando directamente. No es la opinión de una persona que lee o que ve el medio de televisión y ellos forman sus opiniones, o personas que quizás no cuidan a nuestros pacientes. Es muy diferente cuando tú estás directamente envuelto en rendirle servicios médicos a esta persona. Quise explicar eso para que tenga un poquito de introspección el público. La situación del COVID, desafortunadamente, vemos que todos los factores que seguimos para determinar el criterio que usamos, a ver si la batalla se está ganando o si vamos en la dirección opuesta, son de preocuparse. Los números de nosotros que vemos, por ejemplo, la cantidad de pacientes que se han hospitalizado, la gente que se muere, el porcentaje de las personas que se hacen la prueba y salen positivos, los números de personas en intensivo en los hospitales, los números de personas que necesitan ventiladores, todos esos factores que usamos para tener una idea objetiva, concreta, no subjetiva, opinionada, sino data científica objetivo, apuntan hacia una dirección preocupante, ¿verdad? Nadie que yo conozco siente pánico, porque cuando uno está en pánico no puede responder apropiadamente, pero sí es preocupante. Ejemplo, hoy tenemos más de 300 personas que salen positivos. Hace, qué sé yo, un mes teníamos 10, 12, 14, ahora más de 300. Número dos, nos tardamos casi 2 meses en hacer 1,000 pruebas. Ahora estamos haciendo 4,000, 5,000 pruebas por semana. Entonces el público y la gente que opina dice, es la razón por cual los números están subiendo. Entonces nos fijamos el porcentaje de las personas que se hacen el estudio, sean 10 o sean 1,000, qué porcentaje salen positivos. Eso es un número mucho más importante. Y antes estábamos 2%, 1.8%, 3%. Hace, qué sé yo, 10 días, hace 2 semanas estábamos en 3%. Ahorita estamos el día de hoy en 7%. 7%. El estado está en 9%. 7% es un número altísimo. Entonces, no los aburro con los números de las personas que están en el hospital, ventiladores, intensivo, pero sí es importante entender que todos esos números están creciendo a un número alarmante.
¿Cómo estamos en estos momentos en cuanto a la capacidad en los hospitales, en camas, en ventiladores, en el mismo personal? ¿Qué le decimos a la gente para que entiendan que estamos listos, que los podemos recibir, pero que también todos debemos poner de nuestra parte, porque esto es una enfermedad, esto es un virus que está en estos momentos en el aire y que la única forma es guardando la precaución?
Yo creo que yo no lo podría poner en palabras más efectivas, Carolina, que le acabas de usar. Creo que ese es el sentimiento de todos nosotros. Estamos preparados. Estos planes de los hospitales, los 5 hospitales, Mission, Edimburgo, McAllen y Doctors Hospital, que son los 5 hospitales que están recibiendo los pacientes de COVID, todos establecen sus planes de hace meses de cómo ajustarse a los números que están creciendo. Todos los hospitales han estado implementando esos planes que no queríamos implementar. Antes del 1 de mayo, pensábamos que gracias a Dios vamos en la dirección tan bonita, tan buena, y como se esperaba, un mes después, ahora 6 semanas después, los números están tan grandes que se ha tenido que implementar estos planes. Por ejemplo, abrir otras partes del hospital para las camas de los pacientes. Por ejemplo, eliminar o minimizar procedimientos no necesarios. Por ejemplo, tener criterio estricto para admitir solamente a la gente que está sumamente enferma, no todo mundo que llegue y quiera admitirse. Entonces, los planes continúan en modificarse dependiendo de los números que tenemos. Si sigue aumentando, los planes se pueden escalar hasta establecer un hospital alterno, o sea, un edificio alterno en donde se pueden hospitalizar o atender los pacientes que no están tan seriamente enfermos, pero que sí están enfermos, muy enfermos para la casa. Entonces, este hotel o este centro de eventos o como lo quiera nombrar, se prepara para recibir a esos pacientes. Entonces, estamos en este momento adecuadamente para recibir todos los pacientes. Creo que podríamos todavía sostener este sistema si se continúa a duplicar los números que tenemos, pero pronto después se va a saturar. Y se satura, hay planes para ver qué vamos a hacer si se satura. Los ventiladores hay suficientes y hay planes para conseguir más casi inmediatamente. Entonces, lo que tú dices en la pregunta es 100% de acuerdo. Estamos preparados, hay planes por si aumenta, los números son preocupantes, ya hemos implementado planes que tomaban eso en cuenta. Pero lo que creo que el público me gustaría recordarles, porque creo que lo que he dicho es algo que es lógico. Si uno no tiene el privilegio, la bendición de estar en los hospitales y atender a estos pacientes, uno no se da cuenta de algo muy importante. Y eso es la valentía, la dedicación, el dolor humano, las lágrimas en nuestros enfermeros, en los doctores. Y perdona que me emociono, pero
Yo sé,
Es algo,
es duro, es bien difícil.
es algo impactante. O sea, tengo enfermeras embarazadas, tengo gente que no quiere atender a estos pacientes, pero por su obligación a su profesión o por vergüenza de, como decimos en buen mexicano, de rajarse. Ellos ponen sus familias y sus intereses para proveer estos servicios. Hemos tenido doctores, enfermeros que han estado cerca a la muerte porque se han infectado de cuidar los pacientes. Entonces, imagínense todos los días ir a trabajar con el temor o que te va a tocar la unidad o que no estás preparada emocionalmente, te preocupas por tus hijos. Entonces hay un costo humano tan grande y específicamente los enfermeros, los técnicos, los terapistas, los que sacan sangre, los doctores también, pero es nuestro llamado, ¿no? Pero hay gente que realmente le estamos pidiendo, le estamos exigiendo muchísimo. Y la frustración, la razón por cual me ves casi a lágrimas, es que entonces salgo a la comunidad y veo que la gente, por no saber, no es porque la gente es mala, quizás por no entender el gran sacrificio que su prójimo, su primo, su hermano, todo el mundo tenemos enfermeros y tenemos gente de salud en nuestra familia, lo que están haciendo para dar servicios y mucha gente comportándose un poco irresponsable, no toman eso en cuenta. Por eso quería compartir eso contigo.
¿Cómo hacemos antes de cerrar esta entrevista para hacer que nuestra gente, nuestro público, nuestro hispanoparlante entienda que el cubrirnos la boca nos ayuda, que te salvas tú y que salvas a la otra persona también? El utilizar nada más que el mantener la higiene, el de lavarnos las manos y el de utilizar el cubreboca ayuda. ¿Qué le decimos a nuestra gente? Usted como médico, ¿cómo les puede decir a ellos? Úsenlo, porque esto es lo que nos lleva a salvar vidas.
Número uno, hay que educar. Número dos, hay que educar. Número tres, hay que educar. Y número cuatro, hay que ser ejemplo. Hay que ser ejemplo para nuestra comunidad. Tenemos varias muertes, imagínate, varias muertes que la persona que se muere obtuvo la enfermedad de sus hijos, de sus familiares. El papá de 70 años, que el hijo de 20 años fue el que le dio la enfermedad. Imagínate cómo se va a sentir ese hijo. No es que ellos tengan la culpa, no es que sea responsable. A lo mejor esas personas se portaron de la manera más adecuada, pero no tenían síntomas, no se dieron cuenta. Pero es importante entender que la mayoría de los casos que estamos teniendo ahorita son de 20 y 30 años. Y la mayoría de las muertes son de 50, 60 y 70 años. Yo tengo 60 años. Yo no me considero viejito. Entonces, yo pienso que este no es una enfermedad que mucha gente piensa, que es de los abuelos, de la gente. ¿Por qué? Porque dicen, bueno, 40% de las muertes son personas que viven en asilos. Ok, 40% de las muertes que estaban en Nueva York son gente de los asilos, pero no aquí. Aquí la mayoría de las personas que se mueren son personas que están viviendo en la comunidad, no están viviendo en los asilos. Sí hay gente que ha fallecido, pero la mayoría no son la gente que vive en los asilos, son personas que están en la comunidad. Entonces, ¿cómo podemos educar al público? Yo creo que programas como este, dar ejemplos, tener personas que tienen la dicha de entender un poquito más por experiencia o por educación o por X razón que están en esto. Y pues yo creo que básicamente esa es la contestación, educar. La gente
dígales usted, antes de irnos, dígales, utilicen la cobertura facial, lávense las manos, dígaselo usted que es doctor a nuestra gente para que entiendan y acepten que esa es la manera de salvarnos.
Esto es bien fácil, simplemente porque uno es doctor, definitivamente no significa que uno es más inteligente. Lo que significa es que tuviste la oportunidad de educarte, pero hay muchas personas en la comunidad más inteligentes que los doctores. Tienen sus conocimientos en otras cosas. A lo que voy es que es fácil entender que si tú no tienes contacto con otras personas, no te vas a enfermedad. Si tú te tapas, no vas a proveer esa mucosidad, no vas a recibirlo. Si tú te lavas las manos, vas a matar el virus. Si mantienes distancia, no va a poder acercarse. Es lógica. Hasta una persona, hasta un niño de 8 años puede entender el concepto. No es difícil.
Sentido común. Sentido común.
Sentido común.
Muchísimas gracias, doctor Melendez. Se nos termina el tiempo. Nuestro director Carlos Sánchez ya está entrando a pantalla para decirnos ya. Por hoy.
Entiendo.
Entonces, lo vamos a comprometer para que sigamos conversando con nuestra gente, que nos sigan llegando preguntas y que, por supuesto, podamos presentárselas a usted y que usted, como médico y como cabeza del Departamento de Salud de nuestro condado de Hidalgo, tenga la oportunidad de compartir con nuestra gente. Gracias a su trabajo, gracias al trabajo que realizan todos los que están en unión con usted, los enfermeros, los otros doctores, todos los especialistas. Gracias por esta oportunidad, gracias por ayudar a nuestra gente a extender su vida, a salvarla. Yo sé que ese es su título, la parte hipocrática que tienen ustedes, pero debemos decirlo. Gracias en nombre de nuestro condado de Hidalgo, en nombre de esta servidora Carolina Terán. Le deseo lo mejor, cuídese mucho y, por supuesto, ayude a nuestra gente.
Gracias, Carolina. Es un placer.
This concludes today's Facebook Live. I'd like to invite people to visit our newly redesigned website with a lot of new graphics and up-to-date information. It's at hidalgocounty.us. And I'd like to thank Dr. Iván Melendez for his time.
Thank you very much, Carlos. My pleasure.